Hello everyone, and welcome to the second semester of One Butler, the Brain Project. My name is Colton Juneau, a student representative on the Brain Project Committee. As you might know, One Butler, the Brain Project is a year-long, campus-wide initiative focusing on brain health with the goal of developing appreciation of how neuroscience is woven into the tapestry of our lives. Please mark your calendars for Wednesday, March 29th from 12 p.m. to 1 p.m. when we will celebrate the installation of the Big Brains, 12 huge fiberglass brain sculptures that were commissioned by Dr. Jill Bolte-Taylor. In addition to the rest of our speaker series, on Saturday, April 29th, Butler is hosting the Educational Neuroscience Symposium for educators, mental health professionals, parents, and those engaged with young people. You can check the College of Education's website for registration information. Tonight, we are thrilled to have Mrs. Juliet L. King with us this evening. Mrs. King is Assistant Professor and Director of the Graduate Art Therapy Program at Herron School of Art and Design, and Adjunct Assistant Professor in the Department of Neurology at the IU School of Medicine. Ms. King has spent over 15 years as a clinician, administrator, and professor in the art therapy education. Professor King's leadership has spearheaded the development of over 30 clinical internship programs in the city of Indianapolis, and she has vested interest in integrative care for veterans and their families. Her current research includes exploring the integration of creativity, art therapy, and neuroscience with a focus of neuroanatomical correlates of the unconscious. Recently, she edited and published a textbook, Art Therapy, Trauma, Neuroscience, Theoretical and Practical Perspectives. Please join me in welcoming Ms. Juliet King.
Thank you. I'm not sure. Can you hear if I am on this? Can you hear if I just stand here and talk like this? Okay, I'm just going to stand here and talk like this then. Okay. Hi, thank you. I'm so glad to be here. Long awaited. It's been a year since we discussed this talk. And so I'd like to know my audience a little bit first. If students, can you raise your hands? Woo, so many students, that's so cool. And then what about faculty? Another administration? And then people from the community? Oh, awesome. Okay, this is great. All right, wonderful. So before I talk about art therapy, trauma, and neuroscience, it's really important to describe and effectively articulate what art therapy is. Okay, because there's a lot of misunderstandings out there about the mental health and medical profession of art therapy. And so I'm going to start, well, at the beginning of time and give you a history, a historical account of the evolution of art therapy in a nutshell. And then we're going to move on and talk a little bit about art therapy practices and how these practices are connected to brain function and self-expression. And then we're going to talk a little bit about and highlight some examples of clinical practice and how we understand art therapy and theories of creativity in a clinical context in our work with patients. So to begin this, I'm going to ask you if you're comfortable to close your eyes. And I will say the word water. Open your eyes. Okay. What did you see? Kimball? Blue. Blue. What did you see? A Dasani bottle. What did you see? Pretty peach sweater? Nothing really. You saw nothing really. You saw rain. Right. Oh, I know you. Hi. Okay. Who saw this? Really? You saw the words, just the letters. Well, you're very special because that's not very common, right? Because we think in images typically. We think in colors, we think in symbol, we think in sensations, right? And we've been thinking in images and symbols since the beginning of time. And long, long ago, thousands and thousands of years ago, we have had the need since the beginning of time, since crawling out of the primordial ooze, to evolve into apes and evolve into sapiens and evolve into people with different parts of our brains and different ways of thinking. We have had this need to express ourselves. And when we have these frontal cortexes, when we have these neocortexes, when we have these more evolved parts of our brain, we have this need to put an imprint on the earth, to say, hey, this is who I am, and this is what I'm about, and this is why I'm here. But not necessarily with words. It's very difficult to say everything that we humans are about with just words. We need pictures, we need images, we need symbols to help us express ourselves. So what do you think the people that were painting on the caves of Lascaux were trying to tell us? Anyone?
They saw horses.
They saw horses, perhaps hunted horses. Perhaps horses were important to their culture at the time. What do you think the people that recognized Stonehenge were trying to tell us? If it was people. So humans use cultural symbol, and we try to understand ourselves and our purpose through this symbol and these symbols. And we tell stories, and we create myth. And this happens throughout the ages, time after time. And we use simple symbols like a circle to represent abstract concepts, such as the mandala, which is really just a circle, but becomes a space of focus and a template for organization and pattern making, if you're a Tibetan monk that's working with sand, right? And it also becomes a focal point and a way for us to put our energies, our thoughts, and our feelings into one space. And that space, a circle, is also representative of the sun or the moon or the earth or the cosmos. So our symbolism is multi-leveled and it's multi-dimensional. We are not concrete people. We're very dimensional people, and there's a lot about us that happens below the surface. It's not always easy to talk about what happens below the surface. And so that's where this myth comes in, right? And these stories come in, and narrative. And if you read much about brain science and relationships, you learn more about the importance of narrative and storytelling. Excuse me. Stories help us understand ourselves, and they help us understand what happened before, and they help us understand what's going to happen next. And these stories, via myth, such as those in Greek mythology, of Oedipus, tell the tale of intrapsychic conflict and problems in relationships and difficulties getting along with one's parents. And then years go by, and geniuses like Shakespeare transform these myths into stories of Hamlet that we can sit and watch on the stage, right? And they get told and retold over and over and over again. They're the same stories, right? But within those templates, what Carl Jung would call archetypes, we are able to put our own story within. And this is very important. Because imagine all this intrapsychic conflict and all these feelings that you might have of rage towards your father. Can you really easily talk about that? It's not all that simple. We need other ways to tap into all these deep, primitive, expansive feelings that we have. And we do this through imagery. And we've been doing it since the beginning of time. So we've always used images to show abstract concepts such as disease and sickness.